Hi everyone, welcome to our latest episode of PPIE in Practice, where we share snapshots of the public involvement and engagement activity happening across the School for Primary Care Research. Joining us today is Dr. Abi Woodward, NIHR School for Primary Care Research Post-Doctoral Research Fellow, who's currently based at Queen Mary, University of London. And we also have Sarah McMullen, Research Assistant in the Department of Primary Care and Population Health at University College London. They're both here to share more about their recent project aiming to provide better support for Pakistani carers through social prescribing. Thanks both so much for speaking with me. To get us started, would you be able to tell me a little bit more about this project, the aims, and really kind of what you were hoping to achieve from it?
Yeah, sure. So the project aims potential role of culturally relevant and adapted social prescribing services in assisting Pakistani carers with their health and well-being, as well as identifying the cultural and religious influences on carer health behaviours and outcomes. So this is a really important topic because despite there being a high prevalence of informal carers from the Pakistani ethnic group, research shows that they're less likely to engage in support outside of their own informal networks and community networks. And this includes access to healthcare services as well. So I mentioned social prescribing before. This is a non-clinical intervention which involves a referral usually from a healthcare professional to community-based support. And these services can provide health and well-being benefits for carers. But evidence shows that Pakistani and other South Asian populations in the UK are underserved in social prescribing, and we need to better understand why this is the case.
It sounds like a really valuable project, and I'd be really interested to know more about who you involved and how they were involved throughout the project.
Yes, so we involved people who have lived experience as caregivers who were also from a South Asian background. So this included a female carer who's Pakistani and a male carer who is from an Indian background. And having a male involved to provide their cultural perspectives was really important alongside a female carer because South Asian men tend to engage even less with mainstream support. And there can also be additional gendered stigma around men being caregivers. And I'm just going to pass over to Sarah to just say a little bit more about how they were involved.
Yes, thanks, Abby. So both the carers were involved in the planning and design stage of the project, and then they also helped us refine the research question at the funding stage. They were also involved in various activities throughout the project, including the input on the development of recruitment strategies, recruitment materials, including topic guides, sharing those recruitment materials via WhatsApp and carers groups, and then they also helped us translate the English flyer into Urdu for Urdu-speaking carers as well.
And then in addition to that, they were also involved in analysing the interview data that we collected. So they helped by identifying themes and codes in the interview transcripts. And they also had active involvement in our outreach activities. So this included things like co-presenting alongside myself and Sarah at conferences and the end of project held. They shared their lived experience and also examples of how they were actively involved in the research, as well as some of the research findings and giving their perspectives directly on the data.
I guess reflecting on their involvement throughout, what impact do you think the involvement has had to date on yourselves, your project, as well as the people that you involved as well?
Yeah, so they were really heavily involved from the start right through to the end, and throughout the project, I'd say that they took on the role of critical friends. So they challenged our assumptions, they questioned academic perspectives, and they provided really rich personal insights from their own lived experience, particularly around things like family dynamics within South Asian communities. So their input into recruitment strategies and materials, like Sarah had mentioned before, was particularly important. So they supported with translation, they ensured that our study was more accessible for carers from a South Asian background, and their involvement in the data analysis really helped to ensure that information on cultural norms and expectations were considered when we were interpreting the data. And often there were things that us and other members of the academic team might not have picked up on when we were looking through those interview transcripts. One of our main project outputs was the development of an animation. So our PPI members were really heavily involved in the design process for that. For example, we wanted to have male and female carer characters in the animation video. It was really important that they looked relatable to other Pakistani carers, so we spent a lot of time on getting details just right, such as their clothing, their hair, their skin colour, just getting that really right, and the PPI group were really integral to all of that. They were very much involved from the start of that process. So when we met with the graphic designer and they sent over the mood board, we were speaking to the PPI group about colour schemes, and then they became more involved as the storyboard developed and we wrote the script for the voiceover. Sarah is fluent in Urdu, so she worked really closely with one of our PPI members, Madia, to translate the video from English into Urdu. So she's just going to talk a little bit about the reflections on that process now.
So I worked quite closely with our public contributor, Madia, to translate the video from English to Urdu. This was quite a challenging task as there aren't a lot of words and phrases in Urdu, such as for social prescribing. There's no direct translatable word for that. So it was really important for us to ensure that the animation we were producing reached as many people as possible in the Pakistani community who spoke English, but then also spoke Urdu as well.
You've done so much, so I imagine you might have some advice about public involvement that you might be willing to share with others.
Yeah, I think one of the main things is to not be tokenistic with public involvement, and to make sure that you've got enough money in your budget for PPI activities. So I really do value having a group of experts alongside me who have that lived experience. It's really important to make sure your PPI group feel that they are valued, and that you can build a partnership with that team. So provide the time and the space for them to be heard. And through this, I think I'm talking about sort of really taking on board their suggestions and perspectives alongside your own. I was the principal investigator on the project, and I involved my PPI group right from the very beginning when I was writing the funding application, and then I continued to involve them right to the end when we did the end of project event, and even afterwards to deliver further engagement work. So we've done research cafes and workshops, for example, asking them to speak at conferences, and this really helps them to be part of the whole project and just to see the bigger picture, and not just be involved in one single element of it. But you do also need to be really flexible around your PPI team, so you need to discuss with them up front what their role will be, factoring in things like their other commitments, but also talking about what opportunities they might have for involvement and whether they need any support, and really thinking about what they're going to get out of the process as well as what you're going to get out of it.
Yeah, really great advice. Thanks so much for sharing that. I just have one last question for you, and that's what do you plan to do next?
So since the project ended, I've actually completed another small study where I interviewed a group of South Asian carers of people with dementia about the role of social prescribing. And then I was awarded a post-doctoral fellowship through the NIHR School for Primary Care Research, which I began in April this year. So through this, I'm going to be bringing all of the learning together from all of those interviews that I've conducted to date, and I'm undertaking a project that will co-produce a set of recommendations and guidelines needed for the delivery of social prescribing programmes, ensuring that these are inclusive and accessible for family carers from South Asian backgrounds. So I'm still working quite a lot with Sarah. I'm working with the same PPI members, and I've got a few new members joining the team as well, from across Pakistani, Indian and Bangladeshi backgrounds. And it's fundamentally a co-production project, so my PPI team is going to be involved in every aspect, very much sort of making sure that they're equal partners in the project.
Sounds great. Best of luck with the future project, and thank you so much both for joining me today.
Thank you.
Thank you.